In your experience, how common are avascular necrosis hip cases? And when you see them, have you identified common themes about cause, progression, surgery, or recovery?
Question is, how common is avascular necrosis in the hip? And when we do see it, are there common themes as to why it occurred? It depends a little bit on the population in terms of how common it is overall, but it's something that's seen, not infrequently. Avascular necrosis refers to a process where the bone undergoes some cell death because of lack of blood flow. And there are a few different theories as to how that actually occurs, but there's no definite mechanism established for it. Probably the most common causes for avascular necrosis of the hip would be, first, something we'd call idiopathic, which basically means we don't know why it happened. So that's the most common, is us not knowing exactly why it occurred. Second, probably some point in time, the use of oral steroids. I'm not talking about like Arnold Schwarzenegger steroids, but I'm talking about steroids where someone may take for a medical reason. So those have been linked to the development of osteonecrosis or avascular necrosis. A history of excessive alcohol use in the past or present can cause this, and those would be probably the most common types. It's also been linked to some blood clotting disorders, some viruses like HIV, sometimes medications, again, a certain type that's been used to treat HIV, but really I think the first three I mentioned.